Okay, we're live. Are you live?
I'm breathing.
Very good. Very good. We have a guest. Introduce yourself.
Hi, I'm Natalie.
Natalie. Great to have you. This is Dr. Elmer, Advanced Neuro-Spinal Solutions. This is Dr. Elmer's Brain Workshop. And so we brought with us one of our cases, Natalie, and she has a few challenges, and we're going to be discussing some of those, and we'll start though with what was your history and what brought you here to us?
Well, just like the incidences or what's going on in my body, everything?
Just vomit it up.
Okay. Well, I have some injuries from more than one car accident, and I also had I fell straight on my tailbone. I was running and hit the garage door, hit my head, and went straight down. Yeah, so just had some different things there, and just autoimmune and constant allergies, needing a Kleenex, and but yeah.
And what brought you here?
Well, to pretty much bring my life back. And I've known you personally, and so, but yeah, I was in desperate need of a chiropractor, and luckily I found you.
Yeah, and what we do here is quite a bit different, you know, in taking care of some of these things, because seeing a regular chiropractor, you know, most of the things that you describe are not going to get the help that you're looking for.
Yeah, I've been to actually multiple different chiropractors and experienced quite a bit, so I'm happy to be here.
Who else have you seen? I mean, you don't have to name names, but what kind of other specialists have you seen?
Well, just I feel like your everyday chiropractor. Honestly looked it up under my insurance, and we're just like, okay, I'm gonna go try this person and this person, but didn't feel like I was quite taken care of in the same way. And I feel like I am very optimistic in my future being at this chiropractor.
So how old are you?
31.
31. Mm-hmm. So you're really young. And so in envisioning your life in the future, what are some of the things that you do now that you want to make sure that you're heavily involved in the future?
Well, so I'm actually very athletic, and I like to go do stuff active. So I would love to continue running, continue doing sports like basketball or pickleball or tennis, and just keeping up socially. That's my environment I like to be in. I also play the flute professionally, and so I would like to continue that as well. Being able to have a painless, being able to sit without any pain, being able to play with my fingers and hands without any pain. And be able to get the rest and the sleep I need, because I feel a lot of fatigue right now in my life, so hopefully I'll be have that energy.
What do you think are some of the things that are causing that fatigue?
I mean, the obvious thing is that my body is just kind of out of balance, or it's misaligned or something. I mean, you would know more, but I feel like every time I come here I get energy, because after I feel like my body is working better, the nerves are just working better. So what was the question again? So just how do I gain that?
Well, what the original question was, what do you think is contributing to the fatigue
I
in
see.
your life?
Well, I do have a huge lack of sleep right now. For some reason, my body just has a hard time kind of relaxing when it needs to. I do have levels of anxiety for sure throughout the day and at night. And I think also there's just also stuff inside me internally with that autoimmune and I've had mold in my body and stuff like that. That's probably contributing. But yeah, because I eat pretty healthy and I try my best, but I think there's definitely a large physical factor that's probably contributing to that. Mm-hmm.
Okay. When you came here, what did you notice that was different than what you'd experienced in the past?
I'd say there was some home exercises of having my body laying on these sculpted foams and being able to kind of have my body remember to stay a certain way. It was very peculiar to have peppermint up my nose. There's just little random different ways of you doing stuff. But
once we put the peppermint up your nose, what do you notice besides burning in your eye?
So it depends on the day, but generally it gives me more energy. Sometimes like it gets rid of some of the fogginess I have, and I'm just more alert in general.
Okay, that was the word I was hoping for.
Okay.
Very good.
Yeah.
All right, and how do you feel after you do your home exercise? Particularly, let's start with the molds.
Mm-hmm.
How do you feel after molding?
That also depends on the day, but I'd say it kind of does wake me up a little bit actually. It gives me a little bit of energy. I generally feel better. Sometimes I'll have like, it feels like it irritated something, but I think it's just in the process of changing my body. So.
Yeah, the molding is unique because what we're doing is we're laying over these molds. It's changing the curve system, putting the curves back. When you lose the curve in your neck, head forward posture, you stretch the spinal cord, which decreases the blood flow. Mm-hmm. And so when you lay over the molds, it actually gives energy because you're getting greater blood flow, more appropriate blood flow to your spinal cord and to your brainstem, and that is connected to everything, within your body. And so very often in taking care of patients, if they have very low energy, the molding seems to be the most helpful in that. I've had patients where they're so fragile from a neurological point of view that if they do their warm-ups before the molds, they'll be in bed for 3 days. And so I'll have them just mold. And I tell them this really isn't molding, because molding is after you've warmed up and mold, that makes it molding. It's the warm-up that makes it molding. But you're laying over it and increasing the blood flow, which is going to increase the strength of the nervous system. And normally a week of that, and they're a different patient, because now they've got all of this energy because the nervous system is getting the blood flow that it needs.
Yeah, and I find just alongside that, the weights, I've noticed a huge difference.
Cool.
Whether it be even more energy or more alertness, or just since I play the flute, I'll just be, my fingers move faster, it's more balanced.
Yeah.
But yeah, overall, I mean, sometimes I obviously feel pain from that a little bit as my body's kind of getting accustomed to it. But
yeah. Well, another thing that's unique about this is you've had a chance to look at serial X-rays where we took X-rays and then you wore weights and did the molding for a period of time, and then we took re-X-rays. How was that?
I thought that was very motivating to see, and I was actually skeptical of before I came to this office of like, oh, I have to take X-rays and spend all this money and stuff. But I realize now that it's a very necessary part of it. But yeah, I feel like it's definitely eye-opening to see myself and understand it. I very much so like to understand things, and so.
And you were able to see a change?
Yes, yeah, I was able to see a very good change. So.
Very good. And that is highly motivational.
Yes.
Also to the doctor.
Yes, you're like, okay, I'm doing something.
You say, hey, we're getting somewhere. We're really moving forward. Very good. Very good. Now, you mentioned you have an autoimmune. What is being done for the autoimmune?
So currently I take a number of supplements every day, generally in the morning, and maybe even halfway through the day. Do you want me to specifically name what I take? Or?
Yeah, what is the foundation of what you're taking?
So I take vitamin D, and the process of me doing it was just to kind of increase, and every 3 days it would increase even more and more, and then when it felt worse, then I would stop and I would either kind of regress and go back to the dosage I felt good on, or that's what I did with also the other supplements. So there was vitamin D. I take grape seed extract. Give me a second here. And then I also take Postural.
Postural.
Yeah, Postural. That one I've seen has helped a lot, and the resveratrol.
Resveratrol. Very good. And so we arrived at that, finding what your body needed to stop the autoimmune, so it's not attacking you. What did you notice after we found that right combination of what you needed to support your immune system? After we found that, what have you noticed?
I've noticed a lot more energy. That was a huge deal for me, and as well as just because I've had a lot of anxiety. My anxiety went down, and I was able to be better socially and not be so anxious, and just think clear, and just overall that energy kind of helps other areas of my life. So
very cool. Very cool. So, and how do you feel with the home care, the home therapy that you've got? Have you been able to find a way to work that into your life? You have a very busy schedule, and you've got lots of things that you do. How have you found in making that work?
In ways I kind of look forward to it, because I also listen to something like meditation, and I'm able to really get my body to relax, so that I can do more stuff throughout the day.
Very cool.
Yeah.
So you found the best way to make that all work is to do other things with it that you either will be doing or want to do and wouldn't be able to do, and so that's
it kind of forced me to meditate. So.
Oh, very good, very good. Well, excellent.
It's worked. It's a win-win.
It's had more benefit than we counted on. That's great.
Yeah.
We'll take it. Okay. Anything else you'd like to say?
Not necessarily. I think that kind of covered it.
Very
but yeah.
Good. Very good. What you have friends who have difficult challenges, and what would you say to them about connecting with this office?
I would say, I actually even had a family member that has had also dealt with a lot of the same issues, and if not more. And I've been begging them to come, honestly. So, but yeah, I tell some of my friends, I tell them, because they've noticed a difference with my autoimmune protocol, and just, you know, someone mentioned it's just like they've seen a huge significant part of me better. So
Very good.
yeah.
All right, very good. Well, let's take care of you.
Okay.
Mid-back. Mid-back's the worst. Mid-back.
Mid-back, yeah.
Stand up here. Look one way, the other way, and back to the center. Okay, now look up. There you go. Way back, face up.
Jolene McFarland asked, what autoimmune disorder does she have? Sorry I missed it, I was on late.
Chronic fatigue.
Chronic fatigue.
Yeah.
I have constant allergies as well.
Yeah, and yeah, and she has allergies. The thing is, it's a continuum. The allergies are a continuum that becomes eventually an autoimmune. I start with being sick, and as I'm sick a lot over time, the nervous system ramps up the immune system in order so I don't die. And so it runs high. Then mom will notice, oh, I'm not getting croup, colic, I'm not getting sick, but then she'll notice that I've got clear liquid coming out of my nose, and clear liquid, well, we'll call that allergy. We call it sensitivities now because we're so much more educated now. Right. But the more allergies you have, those are things that your nervous system doesn't want to tolerate, doesn't know that it can tolerate from the outside world. That's allergy. And so as you get more of them, you realize, oh my goodness, my nervous system is losing control of that, and my immune system is getting out of control. And then once it gets to the point where the immune system is no longer tolerant of your own tissue, that is autoimmune. It starts to attack it. And when we say, okay, I've got an autoimmune, actually there's only two possibilities, either a Th1 or a Th2, T helper 1 or T helper 2. We always say, well, what autoimmune is it? The way the medical community says, okay, it's according to what is succumbing. If you've got a thyroid that's succumbing, we call it Hashimoto's. If it's an inner lining of your stomach, we call it pernicious anemia. If it's your brain, we call it MS. If it's your connective tissue, we call it systemic lupus erythematosus. But it's all the same in terms of it's either a Th1 or a Th2. And so we have to figure that out. And that's the process that we went through with Natalie, is to figure out how much vitamin D does she need to support the T regulators. Is it a Th1 or a Th2? And then we're going through the botanicals that support either the low Th1 or the low Th2 to get it to balance, so that she no longer attacks herself, no longer killing herself. And that's why she has an increase in energy. She has an increase in energy because imagine if you have an autoimmune, you're sick all the time, and you're seriously sick when you have a flare-up. And so that sucks a lot of energy. And so now that she's no longer attacking herself, that energy is available for life, whatever Natalie wants to do. And so That's how things work in the autoimmune, in the realm of autoimmune. And why do I know how to deal with it? Well, by the time patients get to me, 80% of them already have an autoimmune, because the body's broken down. The body's broken down, and the body drives the brain. The brain breaks down, and therefore the brain functions break down. And on the right side, it's the controls the immune system. On the left side of the brain, it deals with the hormonal system. So I expect that one of those, if not both of those, are going to be having a problem by the time they get to me. And like I say, 80% of my practice, the patient gets here with an autoimmune. And so I've had to find the way, and that way was described by a brilliant doctor named Datis Karazian, and I follow his protocol very strictly. And so, we've loved the results that we've been getting. So
Stacy Nordquist says, is she still playing basketball or resume playing basketball? Does she notice a difference in her stamina?
So I would say a year ago I wasn't, but just this last weekend I was throwing a ball and I was like, oh, I can actually kind of jump now. I was just, so that was kind of like a, what do you call it, not a landmark, but a step up from what I was. I feel like it's like a progression there. So
very cool. Very cool. Right, left, turn your head to the right. Chin up. There we go. I want you to lay on your side facing this way. Face the other way. Face up.
Jolene McFarland says, a milestone.
thank you.
That's my little sister. One of my little sisters.
Should we try doing the entrapment or no?
Sure.
Yeah? Okay.
We may experience screams. What we're dealing with is called entrapment syndrome. If you have a pinch on a nerve, it's called an impingement. If you have a pinch on a blood vessel, it's called an entrapment. And we have 3 entrapment sites in the upper carriage and 3 entrapment sites in the lower carriage. And so we've been dealing with entrapments, and you say, well, why would we have, with Natalie, a prevalence of entrapment syndromes? Well, the severe head forward posture that she tends to have, that we're improving, but that tends to happen for a flute player, a flautist, for a violinist. They tend to have this big time. The head is severely forward, and so it's going to start putting pressure and causing muscles to spasm, ones that help you breathe called the scalenes, ones that work with the collarbone in here, that are the subclavius muscles, also the pec minors. Each one of those can contract and get spasmed, and they put pressure on an individual blood vessel that goes into the upper extremity. And so we're working to get those down. We're working to ultimately change it by getting the posture to change so that the muscle strength front to back, side to side is all balanced, so that it no longer puts that pressure on those blood vessels. That's the long-term solution. But in the interim, especially when our little flautist likes to flout, we want to make sure that she can. So these are the scalenes right here, and they are tender. But I can feel the melting underneath my thumb. Okay, all right, and that goes into the shoulder and arm, and then right under here, just above the collarbone. You can see the collarbone right there. The collarbone, there's a subclavius muscle right here. See, right there is not too bad. It's a little worse right there. It's not quite as bad as the scalenes were. And then it goes under the collarbone, and there's a part of it that is right underneath the collarbone, right here. And this is the pec minor right here. She has less of an issue with that. Okay. This side isn't as bad. This little portion right here is kind of tough, but it's definitely not as bad on this side. And this is very, very relaxed compared to the other side. Yeah.
Should do inguinal? Oh. Ah.
Okay.
Should we do down by the pelvis or?
Okay. The pelvis has a blood vessel called the femoral artery, and it goes into the leg. It divides up into two parts on the back side here, and go ahead and lift one leg, then the other. Okay, does one feel heavier than the other? That's heavier. Okay, so and the femoral artery can get impinged or can get entrapped via the inguinal ligament, and that's between. There's a bone in here called the ASIS, and then the pubic symphysis. There's a ligament there called the inguinal ligament, and when that ligament, when the pelvis gets rocked forward and it gets tight, it can put pressure on the blood vessel, and when it puts pressure on the blood vessel, it decreases the blood flow in the entire leg. So I'm going to put pressure on that inguinal ligament so that we can soften it up a little bit and get more blood flow into that leg. And it's kind of embarrassing putting pressure. This is called the ASIS right here, and right at the base of the ligament. Okay, 8, 9, 10. And then this is the middle of the ligament here. And then this is where it inserts on the pubic symphysis. It's actually not as bad as it's been in the past. It's pretty
I've
good.
been walking a lot. So
Good. Good. Now lift that leg.
Yeah, better.
Better. Because it got more blood flow into the leg. Okay? And we'll do the other side. Tender. Tender. This isn't as bad on this side. Yeah. There. Good. Now lift the leg. Okay. Very good. All right. Good job. Natalie has ligament damage in her neck from a car accident, but most likely also from birth, and the birth trauma when the doctor grabs the head and rips you out of the birth canal.
Explains everything.
Yeah. Okay. She's got big C2 rotation. The spinous is rotated to the left, and the body is rotated significantly to the right, and that's where it's kind of tender right there. That would be tender, wouldn't it? Yeah. Now turn your head up to this side. Okay, now turn your head. Okay. Now look straight ahead. Now rotate right and left like a no. Which way goes farther and easier? Okay. Twist to the left, twist to the right. Keep going. There you go.
Ooh,
Now rotate. That's more evener.
yeah.
Okay. Now side to side. Which way goes farther? Yep, definitely. Right hand, grab the top of your head, pull it over.
It's tender there today.
Yep. Okay, now side to side.
That's better.
It's more even. Okay, it looks smoother too. Okay, now side to side, your whole neck is one. Okay, all right. We want to go to the left then. Okay, go to the left, left hand pull. Okay, all right, now side to side. How's that?
Like this.
No, ear to the shoulder.
Do you mind if we test this part? It's just a little tight.
Pick this up. Okay, now we're going to test the ribs. We want to know if there are any issues in the ribs, particularly that are having an effect on the movement of her upper extremities. And so we have a very clever way to test not every rib individually, but every 3 ribs. So you're going to put your fists up, fists. Okay, you're going to put it like here. This is to test ribs 1 through 3 on each side. So you're going to squeeze together really hard. Okay, which one is weak?
The left.
The left side. Okay, left 1 through 3. Squeeze.
The left.
Yeah, I could feel that one was weak. Okay, squeeze.
Not as bad.
Okay, does it feel equal is the question.
Slightly
Okay.
weaker on the left.
Still weak on the left.
Yeah.
Okay, squeeze.
A little weak on the left.
Weak on the left. So are all left. So face down. Okay, so left side. Maybe you gotta put that down. Okay, there. There we go. Face up. Okay,
Alright.
face up.
Face up.
Okay, we're gonna retest. Okay, so, all right, squeeze,
This is the last try.
equal, squeeze.
I almost feel like it's strong on the left now.
Way to go, overachiever. Squeeze,
Okay.
good, equal.
Better.
Okay, squeeze,
Better for sure.
very good, all right.
Okay.
It never goes in. All
Good thing we didn't record that, Doc.
right. Yeah,
You didn't
no,
see anything.
no evidence.
You know what we could, last thing is parasympathetic. He did that the other day on me because I had so much pressure in my life. And I was like a whole new person after.
Are you talking about
The
caloric?
vibrate, no, the
Oh,
vibrating
vibrate the
one.
throat? Sure.
Parasympathetic.
You bet. Okay, so to finish up with the major player in the parasympathetic nervous system, cranial nerves 3, 5, 7, 9, and 10, but then S2, 3, and 4, and cranial nerve 10 connects to S2, 3, and 4. Also 11 is a part of that whole complex. But what we're going to do is we're going to stimulate the cranial nerves 9 and 10, which are the lower part of your vocal range. It's the glottal sound, the deep voice. So we're gonna stimulate on each side and see which side is more soothing. Okay, do you like that one better or that one better? Okay, and so what we're doing here is this side is running low compared to the other side. We want to achieve balance. When we don't have that balance, there's a dissonance, there's a disharmony within the nervous system, and it causes the whole system to become dysfunctional. Tell me when it's no longer soothing.
Oh, it's still soothing.
There will come a point where it's not. So what this is doing is it's increasing the frequency in the cranial nerves 9 and 10, and that is in the medulla, in the nucleus tractus solitarius. And so as we increase that frequency in the NTS, it's going to be more sensitive to what's going on in your body and what are the needs of your body. Traditionally, most people who have this kind of autonomic dysregulation have cold hands and cold feet. Well, if they have cold hands and cold feet, they also have cold brain, because the nucleus tractus solitarius isn't feeling that it needs to get blood flow to the feet, to the hands, and to the brain, and so it's not responding, and that's why it's cold. And also, when the parasympathetic nervous system goes down, the sympathetic nervous system goes up. That's the fight or flight system, and it's trying to increase the pressure in your body. But it's kind of like if you're watering your garden and you put your thumb on the hose, you'll be able to go farther with it. But if you push hard enough, it will choke the blood flow, and that is why the hands and feet are cold, because the blood flow is being choked, and that's why they swell, because the fluids in the capillaries, it's a very leaky in there to allow exchange, but it's just sitting there, it's just pooling, so it gets to seep out, and that's where you get the swelling. And you'll notice with somebody who has a significant issue on one side, they're going to have a swelling on that side. Well, if they have it long enough, if they have it for a long time, you're going to start to notice it on both sides. Why? Because it's fight or flight, stay alive. And so then it's going to activate the suprarenal glands and put out things like cortisol and adrenaline and that. And so it's going to activate the chemical hormonal system. And now it's going to be a global inflammation in response. And so now you're going to have it on both sides, a little worse usually on the original side. And so we got to stop the autoimmune dysregulation, get it to function the way it's supposed to, and get it to where it can maintain itself. And those are steps that we have to take.
My toes relaxed and my throat is clearer.
Very cool.
Yeah.
Very good.
I have more energy.
Very good. All right, well, let's do the roll. We're going to open up her discs because she needs to be taller. Lay back, come up, lay back, come up, lay back, come up. Now I'm going to roll the disc, the roll a little bit farther. Back, come up. Now lay back, come up. What this does is she's tightening her belly as she comes up, which is increasing the pressure inside her abdomen area, which is decreasing the pressure in the disc and sucking it forward away from the important stuff in the back. Well, go ahead and walk. Let's see how that feels. Very good. All right. Any questions? Please let us know. And what are we doing next week? I need a curveball. Give me something hard. Come on, guys.
We need questions from the audience. Hard
Hard
questions.
questions.
I have a question.
Okay.
So, because I've had sleep issues and anxiety my whole life, is that also considered autoimmune?
Well, that's an excellent question, because can it be the problem? Potentially, but I would see autoimmune as a piece, a greater piece, kind of like looking at an onion, and we're peeling back different layers of that onion. And if we peel back the autoimmune portion is like a thick comforter. When we peel it off, you feel different, right? You're a different case since we peeled away that autoimmune, but you still have a sleep problem. And so when I look at it, I say, well, that looks to me clear that your sleep problem isn't the autoimmune. Your sleep problem was aggravated by the autoimmune, though. That makes sense? And I say, well, I'm getting energy while I sleep. I say, yeah, but you use energy while you sleep too, and you're sucking that energy for the autoimmune. And so now we're going to be able to get you to sleep better, but we've got to get that part of the brain, and particularly this is a brainstem thing. Sleep is a brainstem thing. And so we got to get the brainstem to function. It's really cool. It's right between the pons and the medulla, where you've got all these little nuclei in there that work together and facilitate sleep, and also they reach out to the brain and facilitate dreams and the pieces of dreams, which is really cool how it does that. So as we now look at, okay, now we're not dealing with the autoimmune because you've stopped it from attacking you. Okay, now let's look at sleep, and we'll start breaking that down into its parts and seeing, okay, what really is causing that issue, and then start addressing it. And when we hit the right issue, sleep will work. What is the worst thing I deal with in here? Structurally, scoliosis. What is the worst thing I deal with neurologically? The inflammation in the brain. That's the worst. But remember I said autoimmune's 80%. Guess what? If we were to talk about sleep in here, it's 100%. In fact, my wife is trying to convince me to open a sleep center, which would allow me to be lazier. It's not as hard.
I can run it, Doc.
You can run it?
Yeah, I can run it.
I was going to have you take over this.
Yeah.
Very good. Very good. Excellent question. I love that question.
Yeah.
Because that is one of those questions that goes deeper than autoimmune for me, because I have an answer for that.
Well, because it's interesting, because I've inherited, I feel like, through genetics, through my mom, she's had fibromyalgia, and she thinks she's like trapped stress physically, whereas I think I've expressed it through anxiety.
Mm-hmm.
So I don't know if that's kind of similar in the sense of, we just express our emotions differently. But.
Yeah. Well, it is so interesting to me how you can have 15 people, line them up, they've got the same brain issue, and it's expressed different. Same with autoimmune. I have a group of patients, 4 patients, a family. They're all on the East Coast, and they all have a hyperkinetic disorder, which is like ADHD, obsessive compulsive behaviors, chronic thoughts. We go down this long list, including stuttering, including dystonia. All of those are hyperkinetic. Well, each one has a different one, but it's the same problem.
Yeah.
And so they're expressing it in different ways and trying to help them understand. And sometimes there's a little language barrier because they speak Vietnamese. And so trying to help that understanding come around to, okay, this does look different, but your stuttering and your compulsive behaviors are basically the same problem. It's just a different expression. And so very fun, very cool. And they are brilliant patients, and getting, it's fun to hear the stutter go away, especially at a specific time when they need it to go away, because they're growing up and they're going to be on their own. So, all right. Excellent question. Thank you. We had to have you give us questions every time.
I can keep going. Wow.
Yeah, all right. Wow. Very good. All right, anything else? See you guys next week.